All right, good morning, everyone. It is 9 o'clock. So I am going to call this webinar to order. Our webinar this morning is entitled County and Community Opportunities to Leverage Local ARPA Funds to Support Childcare. This webinar is really a cooperative effort between the Wisconsin Counties Association, the National Association of Counties, as well as the Wisconsin Early Childhood Association, also being supported by, of course, some of our counties, in particular Door County, that is going to serve as a presenter today. My name is Sarah Diedrich Kastorf. I'm the Deputy Director of Government Affairs for the Wisconsin Counties Association, and I will be serving as the moderator for this morning's webinar. In terms of an agenda for today's webinar,
Sarah, you're on mute.
Yep. Not sure what happened, Sarah, but I think you're on mute.
okay, we'll
There
go
we
back.
go.
All right, go back to the beginning.
No, we heard you right until you got to the
Okay.
agenda. Now,
Okay. All right. I apologize for that. I think when I'm working on two screens and my mouse was on the other screen, and I must have hit the mute button as I was trying to get the slide to move forward. So again, I apologize. But again, as we're going to work through today's agenda, so we are going to, I'm going to give a little bit of an overview about why it is that counties should care about childcare and why it's an important issue for counties to get involved and engaged in. Then we're going to hear about childcare in Wisconsin. And we're going to hear a little bit about the ARPA revenue and early childhood priorities and things that we can do with our ARPA funds related to childcare. And then we're going to have some examples from counties about what initiatives counties are undertaking and what some counties are planning to undertake with regard to their ARPA funds. Throughout the presentation, if you have questions, we ask that you please type your questions into the chat or into the Q&A function, and we will go through all of those questions after all of the speakers have completed their presentations. So just to begin, childcare is not a service that is typically provided by counties. It is actually one of the few services in the area of health and human services that counties are not mandated to do. But we do have a real significant interest as counties in ensuring that we have high quality childcare in the state of Wisconsin. I'd say there are two primary reasons for our county interest or investment in the childcare arena. The first really has to do with economic development. And the second relates to the impacts a lack of quality childcare has on the long-term development of a child. If we don't have quality childcare, we could very easily see parents and children in our mental health system. We could see families in our child welfare system, and eventually we may see youth in our youth justice system as well. Now, very quickly on the economic development front, we know that talent attraction is key, meaning that in order for employers within our local communities and within our local counties to be successful, they need a pool of employees that want to live and work in Wisconsin and near their business, their corporation. And so counties and other entities that are involved in economic development efforts need to ensure that we have the services and amenities available that employees want. Now, anecdotally, over the years, when we've had conversations with our county executives and county administrators with regard to what employers are looking for their employees, taxes, which is what folks always jump to immediately as, oh, that's got to be high on the list, low property taxes. And actually, property taxes, tax rates aren't really high on the list. What employers are telling us their employees want are such things as, good schools. They want access to quality childcare. They want things such as recreational and cultural opportunities. And so, looking at childcare as one of those top priorities, having good quality childcare really serves as the workforce behind our workforce. If we don't have childcare, if we don't have a place for children to go, we lose a significant pool of our working age population. With regard to impacts on county programs, we know that the lack of opportunity to positive experiences that lead to appropriate social and emotional development at a young age can lead to negative outcomes down the road. Again, as I stated earlier, whether it's a referral to our child welfare or youth justice systems, or the need for mental health interventions as children get older. Now, I am certainly not an expert on any of these issues, but we do know that positive early experiences that are often provided in a high quality childcare setting allow infants and toddlers the capacity to form those close and secure adult and peer relationships that are so important earlier in life. That they learn the capacity to experience, manage, and express a full range of emotions. Young children also, through high quality childcare, learn to explore the environment and just to learn in general. And so when their needs are met, it means that it can lead to much better positive outcomes in life, be it mental health outcomes, be it a child's ability to enter the workforce later on in life, and as well as be successful in school. I would also suggest that there is not only a tie between childcare and mental health, but childcare, mental health, and employee attraction and retention as well. When a parent has access to high quality childcare, a parent is more at ease when they're at work. And when a parent is more at ease at work, it means their work performance doesn't suffer. A parent is able to concentrate on their work. They become a more productive employee because they're focused on their work. They're not sitting at the job site worried about how their child is doing in the childcare setting, whether their child is being well taken care of, whether their child is learning the skills that they should be learning at a quality childcare center. So again, also when parents are more at ease, we also see fewer issues that might result in a call to Child Protective Services as well. So just really briefly, those are some of the reasons why I think childcare issues are so very important for counties to really pay attention to within their communities. So at this point in the webinar, I'm going to turn it over to our speakers. I am going to just very quickly introduce our slate of speakers for today, and then when they've completed their set of slides, the next speaker will just jump in to try to make all of this as smooth of a transition as possible. So our first speaker today is Ruth Schmidt. Ruth is the Executive Director of the Wisconsin Early Childhood Association. Following Ruth will be Arabella Pluta-Ehlers, who is a Program Manager in the Children, Youth, and Families area at the National Association of Counties. Then we have Paula Drew, who is the Co-Director of the Wisconsin Early Education Shared Services Network. And Paula is with the Wisconsin Early Childhood Association. And then we have joining us from Door County, Corey McFarland, who is the Deputy Director of the County Health and Human Services Department. So with that, I am going to turn it over to Ruth.
Thanks, Sarah. Good morning, everybody. I am Ruth Schmidt. I'm the Executive Director at WCA, Wisconsin Early Childhood Association. I just want to start by giving you just a super high-level overview of our organization. We are a statewide nonprofit. We are the state affiliate of the National Association for the Education of Young Children. That's a mouthful, but we are in part a professional association, a service organization, and then we also work in the area of public policy. From a service perspective, which is a little bit of what informs our presentation today, we work with childcare programs and individual early childhood educators from across the entire state of Wisconsin. And my job here today is to give you some information on what the landscape of childcare looks like. Next slide. So I want to start by introducing you to the concept of what we call childcare gap findings in our state. This is based on a study that is being done by the Bipartisan Policy Center out of Washington, D.C. They have been studying childcare gaps in 35 states across the nation. And we will be sending out this slide deck upon the completion of the presentation today, so you can access the study itself for methodologies and to get more information. What the study is showing is that the potential need for childcare in Wisconsin for children under the age of 5, with all available parents in the workforce, is that we have approximately 288,000 children that would need some sort of care outside of the home. And when we talk about care, we talk about regulated care, which is not to say that there isn't also good unregulated care, but we're talking about regulated care. However, we only have 171,000 slots of regulated care in Wisconsin, leaving a gap of about 117,000 slots of care for children. This does align with what we are finding from pulse studies through the US Census, that back in June, which is where this data is sort of tied to, we were seeing approximately 82,000 parents indicating that they could not enter the workforce because of a lack of childcare. The gap in Wisconsin then puts us at about a 40.6% gap in available care compared to the national average of 31%. And then of course you can see this broad economic impact. And if you want more information about that, just click through the slides when we send them out to you to get more of that data. Next slide, please. So in Wisconsin, in the childcare industry, what we see is that we have a high percent of kiddos that need care outside of the home. We know that about 75% of children under the age of 4 are in some sort of care outside of the home. We also know that prior to COVID, Wisconsin infants had mothers in the workforce at a rate exceeding 70%. The national average is about 61%. Wisconsin is a work ethic state. We have high levels of work attachment. We had them pre-COVID. We are trying to reestablish those connections. We have a lot of mothers of babies that work outside of the home and need access to care. And you can clearly see where the gap in care that I just addressed then causes challenges with this. Next slide. This was a study done by Ready Nation that is also looking at the economic loss in Wisconsin that is due to a shortage specifically of care for infants and toddlers. We're in the red zone. You'll see they demonstrate that economic loss to us as a state is a little over $1 billion. So this is a big economic impact issue for our state, along with healthy communities and a healthy workforce. Next, please. Childcare is expensive. I'm sure most of you that are participating today know that. You've probably lived it. You've paid for it for your own children or watched your children pay for it for your grandchildren. The average annual cost of infant care in our state slightly exceeds $12,000 or about a little over $1,000 a month. In our large urban counties, Milwaukee area, in the Dane County area, Kenosha, Racine areas, those costs for infant care can easily exceed $18,000 to $20,000 per year. It's not a high jump to see how this is incredibly unaffordable for working families in Wisconsin. The median household income in Wisconsin is $61,000 right now. So infant care in a household of 2 parents would be eating up about 18 to 25% of that median family household income. And of course, for single parents, and we're talking a lot about single moms, we're talking about close to 50% of their annual income would need to be used to purchase care for children in order to work outside the home. Next, please. So I'm going to present to you a teeny bit of information from 2 surveys that have been going on. This is a survey that we have done through our Wisconsin Early Education Shared Services Network, which Paula will be speaking about later in the presentation. This is a small scale survey, but I did want to point out that of those programs that are participating in this survey with us, close to 90% are indicating that they are actively attempting to hire staff. And 75% of programs responding are indicating that they have reduced hours of operation or that they have been forced to reduce enrollment directly because of a lack of staffing. Now, we know staffing is a challenge for industries across the entire state. The added dilemma here is that this is an industry that allows other industries to work. So when we have a workforce shortage, we feel that in a multiplier effect. Of 73 programs that reported to us, they've reported losing over 1,000 slots of care because of a staffing shortage. And for each of those slots, you figure that is a mother or a father who are not going into the workforce. Next slide, please. Our national association also has done a survey nationally of childcare programs. So this is a little bit broader. It reflects input from about 600 childcare programs in Wisconsin. What they're reporting is that 76% of programs are experiencing a staffing shortage. Again, serving less kids, increasing their wait lists, closing classrooms, reducing hours of operation. 80% are indicating that they see low wages and their inability to hire, to raise their wages as a key recruitment challenge. We know a lot of industries right now are doing hiring bonuses. They're doing retention bonuses to keep people employed. In childcare, that simply is not possible because of the business model itself and how it operates on razor-thin margins. Right now, we're expecting 17% of those that had responded to close within the next year. And then additionally, 50% of those who responded who had had programs open for less than a year also indicated that they would likely be leaving the field. Next slide. My last piece that I want to present to you is a little bit about the workforce and why this is so much of a challenge. So there's a study that has just been completed by the University of Wisconsin COWS, the Institute for Research on Poverty, the Survey Center, my organization, WCA, and it's been done to produce a report for the Department of Children and Families as part of their Prenatal to 5 initiatives. And it's looked at what is happening with the childcare workforce and industry in Wisconsin. We know that there's about 2,000 regulated family childcare programs in the state. These are programs that provide care directly out of their home, very small shop regulated programs. And we know that after their expenses, they have a take-home income of just over $21,000. Obviously, this is awfully close to living in poverty if you have children in your home with you. For early care and education teachers, so childcare teachers, these are teachers working in group childcare programs, about 21,000 individuals. The median wage right now is $12 an hour, or just about $25,000 a year. We know that half of this workforce has at least an associate's degree. However, we also know that only 1 out of 5 teachers are currently receiving health insurance through their childcare employment. So this is, again, something that most of us take for granted. It's just something that we come to expect in our work. That is not the case in childcare. We also know that across the nation, childcare earnings there's only 2% of other occupations in our nation that earn less than childcare. And I just want us to think about that as we go into thinking about what we can do with resources that are currently available to us and how we prioritize spending those in our state. This is a high need area. It is something that supports your counties, the quality of life in your counties, families and children. So it's super important. And that is where I'm going to close and hand it over to Arabella.
Thank you, Ruth. Good morning, everyone. My name is Arabella Pluta-Ehlers, and I'm the Program Manager for Children, Youth, and Families at the National Association of Counties. And I'm just going to kind of build on the great information we've heard so far to share some strategies and examples about how counties are investing local ARPA funds in prenatal to 3. Next slide. So just quickly, for those of you who are not familiar, the National Association of Counties, or NACO, works to strengthen America's 3,069 counties with the goal of creating healthy, safe, and vibrant communities across America. NACO unites county elected officials and county employees to advocate for county priorities in federal policymaking. And the National Association of Counties Research Foundation serves as the organization's nonprofit. And our mission is to promote exemplary county policies and practices, provide technical assistance to counties, and create spaces for peer exchange. Next slide. I'm not going to spend too long on this slide because Sarah did such a great job of explaining why counties should be thinking about and caring about childcare. But just you can see some examples here of the ways that counties touch the lives of infants and toddlers. And so at the National Association of Counties Research Foundation, we have an initiative called Counties for Kids, which is a public awareness campaign to highlight the importance of the first 3 years and the role that counties can play in this space. So just would encourage you all to check out the resources we have through there. There's opportunities for peer exchange, and our goal is really to engage county leaders across the country in the prenatal to 3 space. So you can visit our website, www.countiesforkids.org, to learn more and get connected. Next slide. So as you all probably know if you're here today, the recently passed American Rescue Plan Act of 2021 has major implications for counties. Counties will interact with various funding supports under the American Rescue Plan. And when you get the slide deck, there's a really great tool that the slide links to that shows kind of where the role counties play in all different funds that have been increased under ARPA. But today we're going to be focusing on the state and local fiscal recovery funds, which includes $65.1 billion in direct flexible funding to counties. These funds are really designed to help turn the tide on the pandemic by supporting the public health response, but also addressing negative economic impacts and investing in equity-focused services. Next slide. So I'll share a link to this in the chat when I'm done speaking, but NACO has a very robust COVID-19 recovery clearinghouse that I would really encourage you all to check out. For today's discussion, I'm going to focus on eligible uses as they pertain to childcare and prenatal debris more broadly. But the clearinghouse has information on other areas. There's a tool where you can ask questions about specific uses if you have more specific questions. So I'll share that link in the chat. But before we get into kind of the specific strategies and examples, just wanted to share some kind of broad overview of how this funding can be used. So the local relief funds can be used to address not only the public health aspects of COVID-19, but also the negative economic impacts. Counties can invest in workers and families, particularly those in industries that were negatively affected by the pandemic. Counties can also invest in and provide support to small businesses. So within this category, there are opportunities to provide supports to childcare providers, to invest in workforce development programs for the childcare workforce, and also to support access to childcare as a workforce support for parents. Next slide. And then per the guidance from the Department of Treasury, counties have some additional flexibility in areas that were disproportionately impacted by COVID-19. And I'll talk a little bit more about this later, but areas that are qualified census tracts will be considered disproportionately impacted. And then counties can also make the case for other areas or populations in their community that have been disproportionately impacted. And in these areas, counties can use local relief funds to address health and educational disparities, to invest in housing in neighborhoods, and promote healthy childhood environments. And in this section of the guidance is where they specifically call out childcare, home visiting, and early learning services as allowable uses. Next slide. So I just want to start off by saying that counties are really in different stages of the process at this time. We know that some have allocated, all or most of their first tranche of funds, while others might still be holding public input meetings and developing their plans. So the following strategies that I'm going to share are informed by both NACO's analysis of the guidance from Treasury and by examples from counties' proposed plans, but this is by no means exhaustive. This is just kind of some starting off points, sharing examples we're seeing so far, but encourage you all to continue thinking creatively about how we can leverage these funds. So as I mentioned, counties can invest in childcare through several avenues. And we're really seeing counties of all sizes focusing on providing stabilization grants to help childcare providers remain open and cover operating costs related to the pandemic. And particularly in areas that have been disproportionately impacted, these funds can also be used to expand capacity. So just 2 examples that, so counties can also provide childcare assistance to parents to help them return to the workforce. So in Oakland County, Michigan, the county is providing childcare scholarships to families who earn up to 300% of the federal poverty line to support costs, including copays and application fees. In Snohomish County, the county is providing vouchers to family members who need childcare while seeking employment, and also covering childcare costs for essential workers specifically. So really getting at that issue that both Ruth and Sarah mentioned, that if we don't have childcare, parents can't return to work in any industries. And finally, counties can leverage premium pay and workforce development flexibilities to support the childcare workforce. And I think we're going to hear a little bit more about this later on. But just another example in Lewis County, New York, in partnership with a local childcare development initiative, the county is exploring funding a program that would train people to open regulated home-based childcare. And other counties are offering signing or retention bonuses to childcare workers. Next slide. So as I mentioned, there are some additional flexibilities in disproportionately impacted communities, and you can see the census definition of a QCT here. But so in these communities, you can, funds can be used to connect residents to public benefits and services. So a lot of counties are creating family resource or supporting family resource centers. In Stanislaus County, California, the county is investing $5 million to help residents connect to local, state, and federal programs that meet basic needs and support self-sufficiency through local community-based organizations and family resource centers. Counties can also support programs like Help Me Grow that help new parents connect to resources in the county. And in these areas, counties can also provide home visiting services to parents. In Travis County, Texas, the county is partnering with the city of Austin to fund home visits for 2,000 families with newborns in partnership with their local United Way. And something that's also been a concern, thinking about how the last year and a half have impacted parental stress and children's development in these disproportionately impacted areas, counties can fund children's mental health services and programs. So this might look like bringing on more staff focused specifically on mental health services for infants and toddlers using ARPA funds. Next slide. And then just some broader approaches to supporting children and families. Counties are able to subgrant to nonprofits that serve young children and families. So particularly in small rural counties that might be dealing with capacity issues, thinking about getting these funds out the door, partnering with local nonprofits may help the funds reach families more quickly and efficiently. Counties can also provide direct assistance to households to alleviate the negative economic impacts of COVID-19, including proportionate cash assistance, aid to unemployed workers, and food assistance. And also really just want to stress that, we know there are a lot of urgent needs happening, but this is also a chance to really bring folks together in your county to think about what you want for children and families now and in the future, and make those plans when you're thinking about implementing this funding. So in Newcastle County, Delaware, the county has created an early learning task force comprised of county elected officials, early childhood leaders, and experts from the community to ensure that the funding plans meet the needs of young children and their families. And then finally, unlike CARES funding, the ARPA funding can be used to replace lost revenue in your county. This is a pretty technical area, so I'm not going to get into it too much, but just want to highlight that these funds can then be used to provide any services that the county government typically provides, including educational, health, or human services. And I'll share in the chat, NACO has a calculator that counties can use to find out what this amount is in your county. If you want to just go to the last slide, it has my contact information. I'm happy to connect offline to answer any questions specific to your county. And also just wanted to flag that we have a blog post coming out this week that will share the strategies that I just walked through and a number of county examples. So I'll make sure that you all get that. And please feel free to reach out with any questions. Thank you.
Thanks, Arabella. So one of the things that I want to talk about a little bit is something that Arabella touched on, which is retention stipends. And the reason that I think I want to raise this up as one of the first types of things that we think should be considered right now in terms of what's happening in childcare is that we need, it's our belief as an organization in the work that we're doing out in the field with educators and with childcare programs, that we're sort of on a precipice where we can either stabilize and stop sort of hemorrhaging the childcare that's available in our state, or we can try to build additional capacity, but if we don't take care of stabilizing the care that's already here and finding ways to keep that care open and available in your communities, we think it's a missed opportunity. In childcare, there's two pieces of information that I think are critical for us to consider. We know childcare is expensive. We also know there's reasons why it is expensive that are not controllable costs to a childcare program, which leaves limited dollars for them to invest into their staff. And so what we see is kind of a chronic compression of wages in this industry. And so we need additional revenues right now to come into childcare in order to keep teachers and family childcare programs doing the incredible work they do to serve the needs of children and families in their community every day of the year in Wisconsin. We also know that there's a need to grow capacity of care. We know there's a need to find ways to better support working families to be able to afford care. But we know if we can't get revenues into childcare right now to help raise wages, we're going to continue to lose staff at an increasingly rapid rate. So we think that the first focus needs to be on stemming the tide of educators leaving this field. What we have been sort of packaging and proposing for groups and counties to think about is a system by which there are quarterly payments made to people that work in this field upon completion of 3 months of work. So this is not paying upfront, this is paying upon completion of work. The payments go directly to the individual so that it is a direct payment to them. We know that this needs to be enough money to make a difference. Now, to some of you, you're going to look and you're going to say $250 to $500 quarterly does not seem to be that much money to make a huge difference to you. But in the world of early care and education, where you're making, where you're making $12 an hour, this is $1 an hour increase. And we think that this would be a nice starting point to look at making quarterly payments to people who are working in classrooms and working in family child care to keep our kids served. The pieces that we would add on to this is a requirement that the payments are being made to people who are already on the Wisconsin registry. This is going to be a technicality for those of you that are not in the field, but it's a way for us to track data, which is critical to know what's going on in the field in Wisconsin. We also believe that individuals would need to be working in Young Star participating programs. Now, obviously, if this is something you're interested in doing in your counties, you can design it however you want. But this is sort of how we would look at sort of a gold standard of doing this. We'd want them in Young Star participating programs, of course, again, in part because it's a way to drive quality up, but also in part because it is better for us in terms of being able to track data and know what's going on with kids in care in Wisconsin. I put in here an option to run this through the Reward Wisconsin program. This is a program that my agency has operated in Wisconsin for over 20 years, so it has an established infrastructure. It does application processing, data tracking, streamlining reporting, makes direct payments, direct deposits, issues 1099s. It's one small piece of what my association does. In some counties of the state, we've already been working on packaging this as a way to run it through that infrastructure. So it's one less step for counties to take, but again, wouldn't be necessary. The big point is get the money out the door to people who are working in this field. This also is something that while you can use ARPA money for it, there have been counties, 12 counties right now that are considering this. Some in terms of ARPA, some in terms of worker advancement initiatives through DWD, some in terms of the new worker innovation grants that are coming out from WEDC and DWD. Additionally, with this, I would say it would be important to pair it with bonus payments for directors and administrators. They earn a little more money, they leave at a little less frequent rate, but they are absolutely the spine of what is going on in childcare and are critical to keeping programs open. So we would add to this a bonus payment system that could be established at whatever level you think is needed in your communities to pay directors and administrators to also keep doors open, stay in the field. And then additionally, I think pairing it with signing bonuses. So The retention stipend is a way to sort of stem the tide on turnover, keep doors open, keep people in classrooms. The signing bonus is the way to ensure that in those programs that said we have reduced capacity, we've reduced hours, it would be a way to help recruit people into the field to work in existing programs, pair them up with signing bonuses, and then put them into a retention stipend route over the course of the next couple of years while there's ARPA funding available. So this is just one sort of quick and dirty option. However you would want to do it in your counties, I think the critical piece is making an argument that we need to invest some revenues into keeping people into this field, or we'll continue to lose capacity of care.
Thanks, Ruth. I'm going to talk a little bit about a shared services model in Wisconsin. It's called the Wisconsin Early Education Shared Services Network, or WESN, as we like to call it, because obviously at WICA, we like to have acronyms that start with W for everything. And what this is it's a network of 135 independent early care and education programs across the southern half of the state that share staff, they pool resources, and they utilize technology to find efficiencies of scale and expertise. Next slide, please. This network leverages collective partnerships and opportunities to benefit the whole. WESN is really focused on increasing financial well-being of childcare providers through efficiencies of scale. Our two main goals are really to save programs time and to save them money that can then be dedicated back to quality programming. During the pandemic, our closure rate across WESN was just about 1%, which was lower than the state and national average. And then the last thing that we do is we advocate for change on behalf of the whole. So if there's something that we're noticing within the sector that isn't working, we're going to advocate for change. Next slide, please. There are 3 levels of services that childcare providers can engage with within WESN. These tiered levels of services work across a continuum to help childcare providers learn to utilize technology so that they can automate their administrative practices, saving more time and increasing greater efficiencies. Our tier 3 is our deepest level of services, and that relies on using technology so that childcare programs can share back office staff. Tier 3 also includes a substitute teacher pool that we hire and train and that work on behalf of the network. Because of the regional localized staff that we hire for this tier, this is a regional approach to the services, and they are only available in some counties of the state. Next slide, please. So this map shows the areas of the state that we're doing our tier 3, our deep level of services. City of Milwaukee, Dane County, and then basically all of the counties from Dane on up until Jackson on the western side of the state. This fall, we'll also be moving into Columbia, Sauk, Dodge, Jefferson, and La Crosse counties with that tier 3 model of support. The tiers 1 and 2 are expanding to be able to reach anybody within the state of Wisconsin through a virtual model. And the last slide has some contact information so that you can see how providers in your communities can access those services. Next slide, please. So WESN is funded in a number of different ways. We collect some fee for services, primarily for the substitute teacher relief squad. We charge about $10 per hour, and that covers about half the costs associated with that part of the programming. We have some national philanthropic dollars through Schmidt Futures. We have a lot of local and regional funding that sometimes just support one of the services we offer, whether that's a substitute teacher pool or purchasing computers that we get out to childcare programs. It kind of depends on the region and the contextual needs of programs, families in that region. Lastly, our largest amount of funding comes from the Department of Children and Families from the state of Wisconsin. Because of recent CURSA funding that's become available to our network, we are able to expand across the state with those tiers 1 and 2, and we are also making all of our services available in both Spanish and English. And the last slide just has more contact information. Programs can join WCN through accessing our website, which is that link at the top there. If you go to the Wisconsin Early Childhood.org website, WCN is a program of WICA, so you can find it that way. Myself and my co-director, Kelly Matthews, our emails are listed here. We are direct contacts from the program, especially community members, counties. We would be the correct contacts to reach out to say, we're interested in bringing Tier 3, for example, to our region. That's all I have to say about WCN. We are going through a formal evaluation with the University of Wisconsin-Madison that will help us put some numbers and data along with our story. Anecdotally, we know that we are saving people time, we are saving people money, they are staying in business, and they are increasing childcare slots within their communities. Thank you.
Hi, I'm Corey McFarland. I'm with the Door County Department of Health and Human Services. I've been with the county since 2015, and I will tell you that since I got here, I've been working very closely with our local United Way to look at the childcare situation in our county. We are obviously a peninsula, we're a long, thin county, and we have a real lack of accessibility for high quality, affordable childcare. If I were to use the same methodology that Ruth cited earlier in terms of our childcare gap, our gap is close to 70%. So we have only 243 regulated slots to serve approximately 800 children age 4 and under in the county. We have 3 group centers and 3 certified family child care providers to serve our entire county. So this has been kind of a perennial problem. So we've made some initiatives to reach out to stakeholders in the community, to talk to experts, and to try to really find some workable solutions for our county. If you could go to the next slide, please. I will say that this really gained momentum in the beginning of 2020. When the United Way hired Christina Studebaker, who's a community impact coordinator, and she wears many hats, but part of her role has really been to take on the child care issues in our county. So I was hoping she could join me today. Unfortunately, she was not able to, but Christina gets a lot of the credit for what I'm going to share with you this morning. Under her leadership and with active participation from the county, we have held numerous community conversations. We've developed some committees to look, take a deeper dive into some of the specific areas that we were interested in. The United Way has done a couple of community surveys to assess needs within the community and also kind of outline a future vision for childcare in Door County. Our members have done a lot of advocacy around early childhood initiatives, and the major focus really has been on educating our community about quality childcare issues. So we held some screenings of No Small Matter, which is a great film I would recommend. It really talks a lot about the importance of quality childcare services in children's brain development and gets at some of the things we heard about early in this presentation about the impact on mental health, child welfare, a lot of issues that the county is really deeply concerned about. And then what was really successful is that we held bi-weekly town hall meetings. And again, these were facilitated by Christina. A number of our staff participated, and we had broad representation from throughout the community, childcare providers, parents, providers of other human service type services. We invited legislators to the final session. We brought in experts to talk about lots of different issues related to childcare, and it was really very informative. Christina and I and a number of our other members from this task force attended lots of state and national webinars. We did a lot of online research, and we reached out and had conversations with experts, including a couple of our earlier panelists today. Go to the next slide, please. So the result of those discussions and town hall sessions that we had in our community is that we identified 17 potential solutions that really rose to the surface in terms of what would work here in Door County. The general goals that we all agreed upon were we wanted to maintain the quality of care and education for the providers we already have. We want to attract and retain the childcare workforce and improve compensation. You've heard a lot about the low compensation that our providers receive. And we really feel like that's really critical to addressing the issues that we're facing. And then the last goal is to maintain and improve affordability. So we looked more closely about, how could we fine tune this? What specifically would work here in Door County? We had a long list. We needed to come up with some priorities. So we came to consensus on 3 focus areas for the next 5 years. The first one being workforce recruitment, training, and retention strategies. We plan to work closely with our local partners. We have a technical college. NWTC has a presence here in the county. The Door County Economic Development Corporation has been very involved in these discussions, and they have some great ideas. So we will kind of partner with those resources that we have here in the community to work on those issues. We really need to develop some ongoing funding sources beyond ARPA that will help us to stabilize and grow the system. And I think that's why partnering with United Way and our community foundation has been really important, because they really are experts in fundraising and tapping into the very generous community that we have here. So they are looking at grants, some charitable donors that we have that are specifically interested in early childhood issues. We are beginning to do some research on Fund 80. We do not currently tap into Fund 80, which is a special tax that school districts can leverage to specifically fund childcare initiatives along with other kind of human service type initiatives. But we need a lot more research on that to know if that would be viable in any parts of our county. And then reaching out to our employment community. We were really fortunate in the early days of COVID. We were really facing what was a very real crisis. One of our 3 licensed group centers was forced to close because of COVID. But because of incredible collaboration in the county and specifically involvement from Door County Medical Center, we were able to help reopen a group provider in the former center that had closed. And the Door Community Child Development Center was born. And it seems to be a very high quality model. They were able to invest in their providers, increase the wages over what they had been in the past, and really save that critical source of childcare in our community. So we want to kind of build on that model, look if there are other opportunities to engage the employment community to expand the availability. And then we really need to look at ways to support our home-based providers. As I said, we only have 3 currently. We really need to build that. We have made efforts over the past several years to try to incentivize individuals to become certified home-based providers. It's not been successful. So we need to look at new strategies to do that. So we are looking at things like the child care network that WCA provides, or something similar in our community, and other ways to just support those current home-based providers, build some networking opportunities for them, and then try to build that capacity in that area. Next slide. So we had this opportunity to look at the ARPA funds available for our county and determine whether that might be a source to support childcare. It feels a little bit premature to me to be talking about this today, because we don't have a detailed plan just yet. I do have the approval of my county administrator to share where we are today. And I think we're in a real similar place as a lot of other counties, maybe a little bit further ahead than some, but we at least are hopeful that this might be an avenue for us. So our county administrator and board invited county departments and community agencies to submit ideas for the use of the funding. There were 27 possible initiatives that were submitted for consideration, and 3 of those were childcare related. So we had a budget retreat on September 1st, and it was all the department heads and the board members. We completed a prioritization exercise just to see out of those 27, which ones had the greatest interest and the greatest chance of success. It was really hopeful that the childcare initiatives were identified overwhelmingly as one of the top priorities. So there was tremendous interest in this area. Because there were 3 different proposals submitted, the board at this point has not specified which of those directions they want us to go. They've asked us to work with our local partners to kind of flesh that out a little bit, determine exactly the direction that we would go, and then present a more detailed proposal. So that's where we are today. So I am working closely with United Way, and we'll be reaching out to our Economic Development Corporation to look at the proposals that were submitted and really kind of package that in a way that we can then pursue the formal approval that we need. So at this stage, what we're looking at is proposing a designated full-time staff position to continue this great work that's happened in terms of researching and moving our planning and implementation forward, and to work on those sustainability efforts. So Christina's doing a great job in terms of what she's able to lend to these efforts, but she does have lots of other things on her plate. So we need a full-time person to just kind of spearhead this for us. We are looking at including some recruitment supports, both for our group centers and for family child care. So what we're hearing here in Door County is the new child care center that was formed is pretty stable in terms of their staffing. We have another one in the northern part of the county that is struggling with retaining their workforce. They currently have several vacancies. This has been a kind of a perennial problem, but I would say COVID has made it a little bit worse. So looking at ways to support those recruitment efforts. And then also the retention incentives that Ruth talked about. So looking at wages, benefits, trainings, anything that we can do to kind of help with that stabilization and retention. And lastly, we're looking at grants for new provider startup costs and ongoing professional development. So those are all kind of general areas yet. We need to do a little bit more work on fine tuning them, but we're really hopeful that we'll be able to get a portion of our county's ARPA funds to support this, in addition to the other funding that we're seeking. So that's really all that I have for you today, unless you have questions. Christina from United Way also is open to local partners reaching out to her with questions about the work of the United Way in the area of childcare, the research that she's done. So feel free to contact either one of us with any questions. Thank you.
All right. Now is the time where we're going to open it up to Q&A. Again, if you have any questions or comments, please feel free to put them into the chat or into the Q&A. Let's see here. I'm taking a look at, let's see what currently in the chat. Arabella has in the chat sent to everybody NACO's clearinghouse. And so everyone should please feel free. We'll leave this open a couple of minutes after we complete the webinar to give you some opportunity in which to download and save these links. So we will do that. Let's see, where else are we at? Please, we were asked to please send this information to everybody. Yes, this webinar was recorded, and we do have the PowerPoint presentation as well. So as soon as we have the recording all finalized and ready to be placed on our website, you'll find this on the WCA website under events, and then under past event materials. That is where we will house it. Lots of compliments for all of the folks. Again, will this presentation be sent to all? It will be placed on our website. Let's see, there's another comment here. I'd like to add that child care resource and referral agencies cover all counties in Wisconsin and provide assistance to families seeking child care. work with individuals who are interested in opening a regulated childcare program. Some provide training as required to open regulated childcare programming and support increasing the quality of the childcare programs once regulated through many programs such as Young Star that was mentioned earlier. There's a link to that as well. Let's see. All right. All right. So I don't know, Ruth, if you have anything at all to talk about on the child care resource and referral agencies. Otherwise, there is a question with regard to how does the county apply to participate in WCA Tier 3?
Yeah, so I'll let Paula tackle the WCA one. I just want to say absolutely. There are CCR&R organizations across the state of Wisconsin that do excellent work in supporting families, supporting childcare programs. They're good partners of ours. And yes, you should absolutely be meeting with and planning with your local childcare resource and referral organization. Paula, you want to tackle the Tier 3 piece?
Yep, absolutely. So the first step would just be to reach out to myself or my co-director, Kelly Matthews. We never move into a region without establishing good partnerships in that community. So anybody from the counties, any other stakeholders in an area we would want to speak to first. We would also do outreach to childcare providers in the community just to make sure that our program is a good fit. And then we would, go from there. Sometimes we do a feasibility study to do those two things I just mentioned and check to see what the contextual challenges are within that community. And sometimes things move a little bit faster just based on available resources and the need.
All right. It also looks like in looking at through the chat and Q&A that looks like there was a request for a follow-up meeting to see where folks are at in their planning and strategies. It sounds as if Door County and Sheboygan County can maybe get together and have some chats. Let's see. Another question. Wages. I'll say, go ahead, Ruth.
Yeah, I was just going to say, you'll have my contact information. You'll have Paula's contact information. If you want WCA to participate in those conversations, don't hesitate to reach out to us. We're happy to hop onto a call with you if it's at all useful.
All right, and who wants to tackle the wages issue?
So I'm trying to understand who could ARPA funding provide structural budget monies for increased wages. So Ryan, I'm trying to fully understand your question. Are you taught? So can you actually hop on audio or not? Is that not possible?
I don't know as if that is possible. I'm wondering if the question, and maybe we want to address the issue of, obviously I don't think, counties would be paying direct wages to childcare employees, for example. So what would be some strategies that counties could use? In what ways could counties get dollars to, agencies, childcare centers? Ruth, Arabella, I think you guys have talked about both identified some potential, some potential solutions to how it is we could work on increasing wages. Maybe you'd want to talk about that a little more here.
So the one thing that I would just add is through the reward program, which was something that I referenced briefly in my earlier comments, but you can link to it and you could reach out to us on this. We have done models in counties, different counties across the state, along with the state model that does direct payments out to individuals that are working. If you wanted to go to changing the wage structure within a child care program, you would need to have a mechanism for that payment to go directly through that child care program, along with then a verification process for ensuring that you see the change in wages increasing as a result of that. And I am not the person to probably talk to about that piece. I would say that part of the reason programs participate in the shared services network is to reduce other costs in their operations and in their administration so that they have more revenue to put towards wages within their programs. That is something that we see happening in shared services. So that's a model by which you can positively influence. And Arabella, I don't know if you have anything else to add in terms of program level.
Yeah, I just wanted to say logistically, counties are able to kind of grant funds to childcare providers. And those can be, for like the operating costs, but also for staff wages, and childcare workers are eligible for premium pay throughout the public health emergency during COVID. And counties are actually able to give pay workers retroactively and do kind of like a lump sum payment. So, your county could choose to say, we're giving childcare workers X amount of retroactive premium pay and kind of grant that out to childcare providers to pay their employees.
All
I will
right.
say, I'll just add that in Door County, that's one of the things we're looking at. And I think our partnership with United Way is helpful in that area because they already do some granting of funds to our childcare providers. So we are looking at kind of a sub-granting application process where the county would be really involved in that process, but it would flow through United Way. Again, if our board approves that, kind of premature at this point.
Okay, we have a couple more questions here before we wrap up. The first, we have been looking at whether we could strategically use ARPA funding for front-end grants to encourage employers in the community to start cooperative childcare services. Our hope is that this would pull employers into the mix to help with long-term sustainability of those childcare operations. Does anyone have examples of good models of employer childcare cooperatives?
I don't know of cooperatives, so to speak. I know there are models of employers that have done on-site childcare. And Brian, I'm sure you're aware that Quick Trip is partnering with Bright Horizons to do childcare in La Crosse for their employees. And there's other smaller models across the state. But I do believe, Brian, that what you're on here is something where there's a lot of interest. There's interest from WEDC, there's interest from DCF in terms of best ways to support businesses and bringing business to the table on this issue. I would love to see a follow-up conversation of some sort happen where you've got some other regions from across the state that come together to talk about that specific issue.
I mentioned that here in Door County, our hospital was a really important partner in reopening the center here in Sturgeon Bay. And I believe the way it works out is that they have a certain number of slots that are designated for hospital employees, but it's also a general resource for the community as a whole. I also know we've talked a lot in the past to encompass childcare in Brown County, which has a lot of partnership models with Schreiber Foods, and they have also partnered with some other businesses in the community as well. Our Economic Development Corporation has proposed developing a childcare incubator of some type. So that's something that we'll continue to explore with them.
All right, good. I guess we have two more questions. Okay, let's see. Where do you see certification in the next 5 years? As someone who oversaw a subcontract for certification, it seems that providers are dwindling every year due to the requirements, very similar to licensure. Ruth, comments on that?
I would ask Paula, who is more deeply in the field, if she has any thoughts. I have a couple comments, but Paula?
Yeah, so I'm not sure that it is necessarily the licensing requirements. I'm just trying to, I think there are some costs associated with either, like, for example, as a family child care provider, to get licensed, you have to have a fence around your yard. That is a pretty costly endeavor. So as a certified provider, I don't believe you do, but if you can only serve 3 children in that example, but if you wanted to move to licensing, you could serve 8, but in order to move to licensing, you do have to have the fence. So there are things that maybe cost money in terms of adapting your environment, but the rules and regulations that are in place, I believe help childcare providers themselves feel safe and able to meet the liability requirements of operating a program. I haven't heard much chatter from childcare providers themselves about deregulation.
And the only thing I would add to that is, and you probably already know this, Wisconsin used to have over 7,000 regulated family childcare programs, and we are now down to about 2,000 regulated family childcare programs. I think there's a lot of reasons that contributed to that, and we need to learn from what those were in order to sort of push this back into, to me, in rural Wisconsin, family childcare must be a huge part of the solution. You simply cannot operate super large childcare programs in rural districts. You can't get the right mix of children, the density of population that you need to support a program with 100 kids. But family childcare is absolutely something I know the state is interested in seeing it grow. So I would keep your eyes out on it and look at like what Corey's talking about in Door County. Absolutely excellent things to be considering for that. And then really quickly, Sarah, do you want me to take the one about college scholarships?
We'll take the final question, Ruth. Yes.
Okay. So, so my association runs the Teach Early Childhood Scholarship Program, which is funded to the tune of about $3 to $4 million a year to support, and that's federal money that comes to us through the state to support people working in childcare to get credit-based education. It is a tri-part program where the individual pays a small amount, the sponsoring childcare program pays a small amount, and then the state and national budget pays the bulk of it. And that is a super stable program. Right now, it is pretty much the only program that exists out there for people who work in this field to get credit-based education. And it's super low cost. The state just recently dropped those percentages to about 5% that individuals and centers have to participate. So it's very low cost. We cover books, we cover tuition, fees, release time. So if you're interested in more on that, go to WCA's the Teach program dropdown on the website that's been listed earlier.
All right. With that, we have exceeded the time that we had indicated we would spend with you this morning. But I do want to thank all of you for joining this webinar and for participating. Again, this webinar, it has been recorded, and the webinar, along with the PowerPoint slides and additional information as it comes to us, some of the links that were included in the chat, we'll put those all of those on our website as well as additional resources for you. And so with that, I just again want to thank you so much for joining us this morning and hope you all have a great week.